The lymphatic system is often seen in your textbook as the green network of vessels, and the function of this network is to transport body fluids. The function of this network is to carry this excess fluid that leaks out of our capillaries into our tissues. It carries that away from the tissues and returns it to the circulatory system. The lymphatic system also has special vessels called lacteals in the digestive tract to absorb fats and transport them back to the circulatory system. And also the lymphatic system is involved in our immunity or protection from disease. So the anatomy of the lymphatic system is not that difficult. The lymphatic pathways begin with these finger-like projections that go into our tissues and capillary beds, and these will absorb excess fluid. These are very tiny lymphatic capillaries. You can see that they're about the size of regular capillaries. Once the fluid goes into the lymphatic capillary, then that fluid is called lymph. The walls of the lymphatic vessels are much like the walls of the veins, but thinner. They become larger and larger vessels and pass through what are called lymph nodes, and then these lymphatic vessels merge to form much larger lymphatic trunks. And the lymphatic trunks are named by the body region that they drain. You don't need to know the names of those trunks, but these trunks will then join one of two collecting ducts, either the thoracic duct or the right lymphatic duct. So here are the lymphatic capillaries, and the lymph is always flowing in one direction, upwards, and it will flow through lymph nodes. Lymphatic vessels become larger and larger, and eventually will then, the fluid will then rejoin the circulatory system. The thoracic duct here drains into the left subclavian vein, and the right lymphatic duct drains into the right subclavian vein. So here you can see the lymph nodes of the breast tissue. Here are axillary lymph nodes, and then these lymph nodes are then draining here into the right subclavian vein. So the fluid, the lymph fluid, is always flowing upwards, and then re-entering in the subclavian veins. That lymphatic tissue is made up of water and other substances that have left the capillary by way of mostly filtration. And